What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, June 29th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of different viruses out there. Each of them carry a health threat that could be threatening to you, whether you know it or not. You could be standing next to someone in the grocery store and they could be positive for COVID. You don't know it. They start coughing or whatever the case is, and guess what? They then pass that along to you. You take it home. You then pass it along to your family, and a family member gets severely sick. It is still happening, not just with COVID, with a lot of different viruses. So you need to be informed of what's going on, what the risk levels are, and what's going on with all these different viruses. Want to do that? Subscribe to my channel down below. Give this a thumbs up if you like the video. The more times people hit that thumbs up button, the more times YouTube will push this content throughout the YouTube algorithm. Share this with anyone you know. That helps push the video out as well and keep more people safe. And of course, hit that notification bell and leave a comment down below. All right, we have several different things that we're going to look at today with a couple different takes on what's currently going on with COVID. One's going to be completely different from the other, but they're two people I usually share with you each week, so I'm going to share with you their weekly update, a couple news stories, then we're going to take a look at some data from the CDC, some of our daily data, and of course we are going to take a look today at ER visits for COVID and see what's going on with that across much of the United States. All right, starting off with this. Up in New Hampshire, it's measles that's a problem today. They are concerned that state officials are investigating a possible measles exposure after international traveler has tested positive for measles. Do you want to read the whole story? You can read about it. I posted it on X, and you can go and read this entire story and precisely when the exposures happened. And it sounds like the traveler did fly in from Logan Airport at Boston. Then they made their way on up into Dartmouth College campus up in New Hampshire. So yes, measles exposure possibility up in New Hampshire. Moving on to this now. Over in Hungary, this is international news. Hungary, whooping cough spreading at an accelerating rate. And they say in previous years, there have not been as many suspected cases reported in a whole year as there have been in a single week. Wow, more cases in a single week of whooping cough than there have been reported for the entire year. That is not good. Moving on now to the weekly update from Mike Horger and his PMC forecast model. So here's what he says this week. You've got about 1 good month left for higher-risk medical and dental visits. Expect 500,000 to 600,000 infections a day the next month in a summer lull. So he's currently calling it a summer lull, but mind you, 500,000 people to 600,000 people getting infected every day, that is a lot of people. And I'll continue on here as to why he's calling it a summer lull. And you can see here, if you look at his chart on his model, the composite forecast, it is ever so slowly going up. So we're starting off at 500,000, but it's gradually making its way up to 600,000 infections a day for the next month, like he said, in the summer lull. It says here, 1.1% of the U.S. is actively infectious, 1 in 90. We're looking at 3.7 million infections a week and 187,000 plus resulting in long COVID cases a week. Now remember, that could be something anywhere from a mild issue such as a cough that won't go away to something much more severe. You become bedridden from COVID. All that does happen and everything else in between. If you have to go see a cardiologist, if you have to go see a pulmonologist, if you have to go see a neurosurgeon or any type of specialist just after having COVID, it's likely a form of long COVID. I saw that comparison made the other day. Someone put that quote the other day. It says, how does transmission compare to late June in past years? Well, 2023 today is 1.9 times higher. 2022, 2.3 times higher in 2022 because we had the BA.2 surge, which that started up a little earlier. And so that was higher than today. But hey, 2021, we are 5.6 times higher today. 2020, we're 2.8 times higher today. We're in a hot law with back to school soon. So what he means is we're in a law where it's just gradually going up right now. And I guess we don't see his model any further out. But I guess what he's trying to say is when kids go back to school, the school outbreaks, they're going to happen. They've been happening pretty much every year. So we'll probably see another boost then. Maybe there'll actually be a period where it slows before then. I'm hoping anyhow. But it sounds like once back to school happens, because remember, let's go back to the beginning. You've got 1 good month left for higher risk medical and dental visits. And then he's saying back to school. So in other words, apparently his model must be thinking back to school, kaboom, cases will go even higher. And who knows? At that point, there very well could be yet another variant because these variants have been evolving quite rapidly lately. All right, reading this now. With the UK surveillance study tabled, our best international comparisons is now Canada. How about that? Remember when it used to be UK? Well, now it is Canada. Note that independent estimates there from Variety Labs team are eerily similar to our own US-based estimates. Data you can trust. And let's take a look at this. Yep, this is very similar. Chances of someone infected in the US in a group of 10, 10.6 versus 11.3. Group of 30, 28.6 versus 30.2. And a group of 50, 43 versus 45.1. And so, yeah, that is very good. And you can see the UK is actually a lot lower now. But again, wastewater data, it's not really there in the UK anymore. Continuing on, if you interact with 20 people this week, there's about a 1 in 5 chance someone was actively infectious with COVID. Interact with 100 people, 2 in 3 chance someone has COVID. And finally, you can catch the entire dashboard on his website, pmc19.covid/data. Alrighty, so that is the weekly update from Mike Horger. And that is a good one, but now let's go to another one. Now let's go over to Jay Weiland and his update on where things are at right now. There is no model with this update, but June 28th update. A large increase seen this week, plus 30%. All regions increasing, west at high transmission levels, south at medium, northeast and midwest at low levels. So remember, the northeast and the midwest, yes, we've seen New York rising. Yes, we're starting to see New Jersey rise, maybe a few other places. But really, the northeast and the midwest have not seen much of a surge yet. So again, if we go back to Mike Hogar and his update, that could be a part of the reason why back to school could be a bigger deal as well, because you have to understand, if we're not seeing big rises right now in the Midwest or the Northeast, the Midwest is still not seeing much of a rise at all. If we're not seeing it right now, that means immunity over time is going to wane more and more, and by the time those kids are back in the classroom, guess what's going to happen? Yep, maybe the immunity will have waned enough that could actually cause some outbreaks. Just speculating here, trying to make some sense of both of these different opinions, but here's where he says we are. 320,000 new infections a day, 1 in every 104 people currently infected, 1.6 times lower than the 12-month average, and when you look at the chart here, you can see here, wow, it's really starting to go up here. So if we kept going up at this rate, we would reach those 500 to 600,000 infections a day. And right now, ratio of people currently infected by region, Midwest, 1 in 136. The South, 1 in 76. The Northeast, 1 in 189. And the West is 1 in 43. All trending upward. And we can see here, the West continues to really go upward. Really a bad situation right now that is playing out in the West right now. Alrighty, moving on now to this. Italy, COVID cases up 20% in the last week. KP.3 variant accounted for 27.6% of all samples, and this is from June 20th to June 26th. Reported cases, 2,504. Again, that's up 20%. The positivity rate is 3.2%, and that is up by 0.5%. Deaths are up by 50%, and 21 deaths total. Hospitalizations and ICUs are not available at this time. All right, moving on. Weekly wastewater scan update. I was going to save this for tomorrow, but I said, nah, let's go with it today. Alrighty, COVID-19 SARS-CoV-2 is now in the medium category nationwide, and in some regions with medium concentrations but no significant trend up or down over the last 3 days. However, the Midwest and South are in the high category. Yet again, another perspective. See, I'm trying to give you every perspective possible. Why? Because it's important to understand what is going on from several different perspectives. However, despite that, see this mask right here? You need to be taking precautions in all regions, no matter what. Like I said before, I'll say it again. I say this often on the video. One person in line in front of you at the grocery store, they don't appear to be sick, but they are infected. If you're not masking, guess what? They could pass that on to you. COVID is an airborne virus with airborne transmission. It takes one person to be infected to get you infected and to unfortunately maybe even cause you to go to the hospital, long COVID, or God forbid, death. Yes, death still happens with COVID. Influenza, they say, in every region is low at this time. Influenza A and B are almost too near zero at this time. H5 influenza has been detected in 7 states: Texas, Michigan, Idaho, Iowa, Minnesota, South Dakota, and California. And they also say some states have had infected cattle herds reported. We know about that. HMPV nationally and in all regions is now in the low category. Norovirus remains in the medium category with medium concentrations and a downward trend over the last 3 weeks nationally and in every region. All right, taking a look at today's pollen levels, drum roll please. Pollen levels are at 49% of the country is in low to medium status. The highest is in the central and we'll just say western region, generally from west of the Mississippi, and as you can see, continues to be a hotspot in Oregon. Taking a look at what's going on with the national levels of air quality, starting off with the West Coast first. And you can see, not too bad, but there are a couple wildfires ongoing in California that are causing things to be not so good. And in the east, we do see there is some yellow and oranges. Eventually, it will load up here, but there is quite a few yellows and oranges, generally from Georgia, Alabama, Mississippi, Louisiana, just north of Louisiana and Arkansas, Texas on northeastward. Yes, it's starting to spread into New England as well. There's a warm front moving through. As that warm front lifts to the northeast, what's going to happen? This bad air quality is going to move in behind it. Taking a look at heat-related illnesses, they're increasing in the majority of the regions across the United States, with exceptions to some reason for Ohio and Indiana. They may not be reporting for some reason, to be honest with you. Already, taking a look over where I talk about weather. Yes, I have a place where I do that. Climate Data Report on X. You want to follow me there. Big doings. We're talking about Tropical Storm Beryl, and that is going to become a hurricane either in the next update at 5 p.m. or 8 o'clock. Probably by the end of the day, Beryl is going to be given hurricane status. And if you want to follow my videos on that, I do have a place where I do that. Let's refresh this. You can see here, I did post an update just about 4 hours ago. And if they upgrade it to a hurricane this evening, I may have to do another update because this is pretty serious. Plus, we're also tracking thunderstorms across the United States. There's a thunderstorm threat here in the northeast U.S. today and tomorrow. So, very busy times over on my weather channel. All right, moving on to this now. Philadelphia yesterday had 840 EMS incidents. Doing a live looking at what's going on surrounding Philadelphia right now. Just 7 calls in Montgomery County. Not very busy. That is a good thing. And taking a look at what's going on with Chester County, we do see stroke, sick person, respiratory difficulty, seizures, respiratory difficulty, and syncope. So there are some calls to be had right now. Taking a look at Walgreens this week, the national positivity rate is upward at 34.1%. Yet again, another perspective here, Walgreens has been continuously going upward. So that would go with the other data that says, hey, things are going upward right now at a decent clip. Taking a look at wastewater this week, we'll do our full wastewater update, I think, tomorrow. So I think we're actually going to probably skip over this today, but I do want to show you this. Emergency department visits. All these places in orange and the brighter shades of orange, all the states that are in the brighter orange colors, they are seeing a rise at this time. And let's take a look at some of these states. I got a view here where we can take a look at all the states if we wanted to, and maybe we will. United States, we can see, is going upward. Alabama is going upward at a steady clip at this time. Alaska had a rapid rise. Now it's slowed off, but it's still going upward. Arizona is steadily going up. Arkansas is not going up that much. California, we can see for emergency department visits, it's continuing its steady clip upward. If anything, it may have picked up the pace a little bit more. Colorado is going upward. Connecticut's going upward. If you live in Delaware, that is also now starting to rise for COVID emergency department visits. District of Columbia, Washington, D.C., you're actually going downward a little bit. Florida continues to go up, and Florida's really starting to pick up the pace. They're probably seeing about one of the biggest rises, at least so far. Let's go through some more states. Georgia, also starting to pick up the pace now. Guam, look at this. Haven't talked about there in a while. Guam is going upward for COVID. Hawaii, good news there. Take a look at this. Hawaii has peaked, and emergency department visits are starting to drop. We hope it stays that way. Idaho is going upward a little bit. Illinois, Indiana, Iowa, all going upward. I would say Iowa is just in the very infant stages of starting to go upward. Same thing with Kansas. Not seeing a big increase in Kansas just yet. Kentucky is going upward. Louisiana is going upward, and they're actually starting to pick up the pace. Maine is not rising yet. In fact, in the last week, look at Maine. Maine actually dropped a little bit. Maryland is going up. Massachusetts is going up. Michigan, not going up yet. Very early stages if it is. So, Michigan, you're still okay for now. Mississippi, and that's starting to go upward for emergency department visits. Montana was rising, then it slowed off a little bit. Nebraska, just infant stages of going upward. Nevada, yes, your COVID ER visits, they are going up. And reminder, these are people who are diagnosed with COVID. New Hampshire, yes, up ever so slightly. New Jersey is starting to go upward a bit. And New Mexico was going up, but on the most recent update, ever so slight indication that maybe it went down a little bit. But then again, take a look in the past. They have had notches like that before. So it could just be another notch, and then they start going right back up once again. New York is going upward, and as noted this week, New York has picked up the pace a little bit, so this should probably go up even more in the future. North Carolina, that is starting to go upward. North Dakota is actually going down. Good news there. Ohio has been going up. Not as fast this week, though. Oregon continues to rise. Pennsylvania is rising. Rhode Island, kind of bouncing. It's just slowly going up. South Carolina, definitely rising. South Dakota is flat this week. That doesn't look like it's rising anymore. Tennessee is just slightly going up. Texas is starting to pick up the pace, unfortunately. It's summertime in Texas. What do you expect? Utah is going up a little bit. Vermont, at this time, is actually dropping. Good news in Vermont. Virginia is starting to go up faster. Washington looks like it has leveled off just a little bit, so not rising as much there. That's some good news. West Virginia is not really rising all that fast. Wisconsin is starting to pick up the pace. And Wyoming was going up. Now you're just bouncing around all over the place. Doesn't look like you're really going up that much right now, which is some good news. So there you go. We looked at all the states listed here. How about that? Epidemic status now. For epidemic status, it's growing in all the southern states at this point, with exceptions to Arkansas and Oklahoma, where it is just only likely growing. In the Northeast, unfortunately, we have nothing out of New York and nothing out of Connecticut at this time. It's either stable or uncertain. Very well could be uncertain because New York State, we do note that cases and hospitalizations have been creeping upward, so I don't know why they're not reporting. The West Coast is either likely growing or is growing. Hawaii at this time, take a look at that. Hawaii at this time is likely declining now. All right, let's go over to New Jersey. We will end today on New Jersey. And drumroll, please. I thought I had this refreshed. Let's see. How many hospitals reported in New Jersey today? 70 out of 70 and saying 123 hospitalizations. I can tell you right now, that number is not correct. Why is that number not correct? Because yesterday was 70 out of 70, and it was over 200. So they keep putting out different results each day. We cannot get an accurate number from New Jersey, unfortunately. Alrighty, folks, that does it for the Saturday edition of the Pandemic Update. We'll have another one again tomorrow. Remember, we do these 7 days a week. Unless something should come up that prevents me from doing a video, we try to do these 7 days a week because it's really important. And guess what? The virus doesn't take a day off. Why should I? Alrighty, if you enjoyed this video, give it a thumbs up, subscribe down below, share this video with anyone one you'd know, and of course, hit that notification bell and leave a comment down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday evening. Thanks for watching.